Hello everyone. In this video, I'm going to tell you about a condition called resistant hypertension. If you're new to the channel, I'm Hafiz and I'm a cardiologist training in London. Here I explain heart conditions in a way that is easy to understand, and I also provide teaching for medical students and junior doctors. If you want to know more about your heart and learn about heart disease, then hit the subscribe button and bell icon so you get a notification every time I post a video. When you're diagnosed with high blood pressure, also called hypertension, you'll be prescribed medications to control your blood pressure. If one agent isn't enough to control your blood pressure, other agents that have different mechanisms of action will be added. Resistant hypertension is blood pressure that remains high despite using at least 3 blood pressure medications of different classes. These would typically be a calcium channel blocker, an inhibitor of the renin-angiotensin system, and a diuretic. All these agents should be prescribed at the maximum tolerated dose. We worry about resistant hypertension as it's associated with an increased risk of premature cardiovascular disease, such as heart disease and stroke. Approximately 20% of people with high blood pressure have treatment-resistant disease. Cases of resistant hypertension should be referred to a blood pressure specialist. The specialist can be a cardiologist, clinical pharmacologist, or sometimes a kidney doctor. The blood pressure specialist will do the initial workup to rule out pseudo-resistant hypertension, which is also known as white coat hypertension. I've done a separate video on this condition, so you can watch that video after. The specialist will also check for non-adherence to medication and make sure you actually take the medications, but also taking them correctly. Non-adherence to medication is a challenge in blood pressure management. Checking for adherence takes time and resources. It requires a frank discussion with the patient to ensure they are taking the blood pressure medications as prescribed. There are also other direct techniques to measure non-adherence by urinary or blood measurement of the active drug. This is important to ensure we do not escalate treatment in a patient who is not taking the medications in the first place. This can cause lots of problems to the patient, including low blood pressure and side effects of medications that they may not even need. And finally, as part of the workup, the blood pressure specialist will screen for secondary causes of hypertension. In 1 in 5 cases of resistant hypertension, there is an identifiable cause. There are a number of conditions that can cause hypertension, such as primary aldosteronism, chronic kidney disease, renal artery stenosis, obstructive sleep apnea, and rarer causes such as pheochromocytoma. Of these, the most common cause of secondary hypertension is primary aldosteronism, also known as Conn syndrome. This is when your adrenal gland, which is just above your kidneys, produces too much aldosterone. Aldosterone is a steroid hormone and it controls sodium and potassium levels in your blood. It increases plasma sodium by increasing sodium reabsorption in the kidneys, causing water retention. It is diagnosed by measuring your serum aldosterone, plasma renin activity, and electrolytes. Typically in Conn syndrome, you have low renin, low potassium, high sodium, and aldosterone. Some patients with treatment-resistant hypertension have been found to have increased aldosterone production, even though they do not have primary aldosteronism. There is a lot of research interest in this area. Recently, a new drug called baxdrostat just completed their phase 2 trial. It works by blocking an enzyme called aldosterone synthase that catalyzes the final steps of aldosterone synthesis from cholesterol. This medication raises hope for patients with treatment-resistant disease. So to summarize, resistant hypertension is seen in about 20% of people with high blood pressure. In cases of resistant hypertension, the patient should be under the care of a blood pressure specialist, and investigations should be performed to rule out white coat syndrome, treatment non-adherence, and secondary causes of hypertension. I hope that was helpful, and thanks for watching.